Yeah, so thank you very much for inviting me to speak today. My work is in some ways quite similar to what Sam has shown, but I do use different approaches, so it might be an interesting contrast here. So I'll be talking not about malaria, but about yellow fever and the environmental drivers of transmission in Africa. So yellow fever is a vector-borne viral infection transmitted by day-biting mosquitoes, Aedes aegypti predominantly. It's endemic in Africa and Latin America. 90% of the burden actually are thought to occur in Africa, and that's where I'll focus on in this talk. There is a reservoir in non-human primates like monkeys. So through this zoonotic transmission, there can then be spillover infections into human populations. And we can have sylvatic cycles where humans are infected sort of accidentally and the infection goes nowhere because they're not bitten any further. But if this is introduced into urban areas, into large human population centers, these outbreaks can be really quite disruptive. And in fact, there was a very large outbreak of yellow fever in Angola, which started in the capital last year. It was probably the largest yellow fever outbreak in 30 years. The spectrum of clinical disease is very broad. Most people get only mild symptoms, flu-like, unspecific. About 10% or so of people get severe symptoms, which include jaundice, which gives it its name, or hemorrhaging symptoms. And about half of those severe cases will actually die. However, yellow fever is vaccine preventable. The vaccine has been around since the 1930s. It's very safe and very efficacious. So as I said, globally it's endemic in Africa and Latin America. It has never been seen in Asia, but we've been looking at the sort of environmental factors that are needed primarily to sustain the vectors, but also the viral replication in the vectors. So what we've done, we've looked at where it occurs in Africa. Here these circles, each circle is a recorded yellow fever outbreak, and the size of the circle indicates how many people were affected. So we've kind of correlated that with environmental variables. In this example, we've just used temperature and the vegetation index to get a risk map for yellow fever occurrence. And that's what you get here in Africa. And what we've done then is to extrapolate that to the rest of the globe. And we get a high risk here in Latin America, for instance, where yellow fever is also endemic. So this global risk map pretty much agrees with the distribution maps of vector species that transmit yellow fever, which is quite nice. The one thing that's quite worrying here is the kind of high risk in Asia. There are really large populations that live there, and we don't understand why yellow fever hasn't been seen there. So there are the zoonotic reservoirs that could perpetuate the virus. There are the relevant vectors, but it just doesn't seem to take off. And it's a worry when you've got a large outbreaks and increasing travel. What if? Could it take hold there? So that's generally a worry in yellow fever control. In 2005, WHO, UNICEF and Gavi set up the Yellow Fever Initiative, which was set to fund vaccination at a large scale through a combination of preventive campaigns and routine infant immunization. And in 2005, we had this sort of picture of vaccination coverage in Africa with quite limited coverage. Here it's very patchy, and that coverage sort of came from outbreak response campaigns. Whenever there was an outbreak, they'd go in and locally vaccinate, but they didn't typically do a very sort of organized, larger scale approach of vaccination. So the Yellow Fever Initiative changed that. They've put massive funding in, and in 2017 it's quite a different situation with very high coverage in West Africa, where yellow fever is most endemic, through these large-scale campaigns. So I'm involved working with Gavi to estimate the impact of these investments. And this work is now integrated into a new vaccine impact modeling consortium that we're hosting here at Imperial College. So to assess the impact of the yellow fever vaccine, the difficult thing is to estimate the burden, because the surveillance data is quite poor. Yellow fever is hugely underreported, and serology is challenging because there are cross-reactivities with related viruses. However, what we have done is develop a model to estimate the yellow fever burden across Africa. And to do that, we've integrated various different data sets. So obviously we need disease-specific data, surveillance and outbreak data as shown on that map up there. We're also using serological data. And on the environmental side, we're using demographic data because we're interested in where people live, and temperature, rainfall, and vegetation index. And these obviously are seasonal variables. So it's a complex model that we've developed. It's a generalized linear model that we fitted to these environmental covariates. And from that, we get a risk map of yellow fever, and that's a nice step, and we see very much this gradient from West Africa, very high risk, to much lower risk in East Africa, which reflects where the outbreaks are reported. But in order to assess the burden from this, we need to somehow tie down the level of transmission intensity associated with each risk category. So for the locations where we have serological data, we fitted a force of infection. And then for each of these locations, primarily in Central Central Africa, but now more recently we've got data from East Africa as well. So for each of these locations, we've then looked at what the estimated force of infection from the serology, what level of risk on this map that relates to, and then extrapolated the force of infection from this map. And we get a scale at the end. And that, now we've got a quantitative scale of force of infection. We can use that to estimate the total burden based on the population size, and then the impact of vaccination. One of the questions that are really interesting is that we don't really understand why there is this gradient in transmission intensity from West Africa to East Africa. And that's something we're looking into further, some work I'm doing with Arran Hamlet, who's sitting in the audience as well. Yes, I'll get to that in a moment. So first of all, from this model, we've estimated the burden of yellow fever in Africa to be about 1 million infections each year, which will then translate into about 50 to 400,000 cases. So you see the confidence intervals are really, really wide. That reflects that the data are quite limited, and the underreporting, the level of underreporting is still not well understood. And we're estimating a number of deaths between 20 and 200,000 per year. So that's for the year 2013. So looking at seasonality, what we've done is define a temperature suitability index, similar to what Sam mentioned earlier. It's basically pulling together the temperature-dependent aspects that relate to the transmission intensity. So for instance, we've got the biting rate of a mosquito. The more frequent a mosquito bites, the more chances are there of infection, of either the mosquito becoming infected or then passing on the infection once the mosquito is through its incubation period. We've got here the death rate of the mosquito and the extrinsic incubation period, so that's the incubation period in the mosquito. So the longer that is, the less likely is transmission, for instance. And so that's the temperature-dependent aspects, and we can estimate R naught with a few further quantities taking into account the vector-to-host ratio. So the more mosquitoes there are, the more people are being bitten, and the higher is the risk of an epidemic becoming established. And we've got the transmission rates for each individual bite. And similar to the previous approaches, we've done some regression modeling with that, but here we've not just used the presence and absence of outbreak reports, but we've also looked at in which month these outbreaks happened to capture the seasonality. So here on those, on these maps there, I'm showing up there the probability of an outbreak throughout the year. And then we've got the environmental patterns. So we've got rainfall patterns varying throughout the year, temperature suitability. Basically, temperature is best when it's really hot. So, for instance, the Sahara has a really high temperature suitability, but obviously it doesn't have enough rainfall to sustain mosquito populations. Now, when you then look at the interplay between temperature suitability and rainfall, because you need both, you need the high temperature as well as enough rainfall to sustain mosquitoes. And if you take that together on a monthly basis, that reproduces actually quite well the seasonal patterns seen in an outbreak. And here we get this gradient from east to west. So it's, this indicates that it's this synchronicity or asynchronicity between suitable temperatures and enough rainfall that actually explains this gradient of transmission, which is quite an exciting result. So yellow fever, like any vector-borne disease, is extremely dependent on climatic conditions and driven by temperature and rainfall because they influence the vector abundance. And as both are highly seasonal and seasonality is important, and the interplay between both factors varies geographically, which influences the geographic extent of yellow fever spread. So in the broader scale, I'm working on yellow fever in a collaboration with Gavi and WHO, and in the wider context of vaccine impact modeling and the climate work. So far we've focused on Africa, but we're also looking to extend to the global scale, and also getting involved on top of yellow fever in some dengue modeling, and obviously there's a lot of malaria work going on. I'd like to thank Arran and Kevin, who've been doing quite a lot of the work that I've shown today, and Neil, who's given a lot of input in this. And well, we're working together with the World Health Organization, now funded through Gavi and the Gates Foundation. Thank you.